Hi guys, so our group will be doing a video on diuretics, and diuretics are the first line of treatment when it comes to high blood pressure and edema. We'll be discussing the different classifications of diuretics and how it affects the ROS system, which actually regulates our blood pressure, and the nephron, which is the filtrating unit of the kidney. Some diuretics can also be used for other things like narrow angle glaucoma and high altitude sickness. Now I'll be discussing the pathophysiology of high blood pressure and how our body regulates it through the ROS system, as well as the functions and structure of the nephron. The renin-angiotensin-aldosterone system regulates our blood pressure. We have baroreceptors in the kidneys that sense when our blood pressure drops. This causes the sympathetic nervous system to stimulate the release of renin from the kidneys. As the renin circulates the body, it activates angiotensinogen from the liver and creates angiotensin 1. ACE, or angiotensin-converting enzymes that are usually found on the endothelium of our lungs and kidneys, convert angiotensin 1 to angiotensin 2. Angiotensin 2 constricts blood vessels, binds to the hypothalamus to increase thirst and water intake, and it also stimulates the release of antidiuretic hormone from the posterior pituitary gland. Most importantly, angiotensin 2 stimulates the release of aldosterone, which increases blood volume, water retention, and sodium retention in the kidneys. This results in the increase of blood pressure. Inside of our kidneys, we have millions of nephrons. It is the functional unit of the kidneys. It consists of the glomerulus and the tubules. The glomerulus is surrounded by the Bowman's capsule and it filters the blood. The tubules then remove the waste and return substances to the blood. Thiazide diuretics act on the renal distal tubule, while loop diuretics act on the loop of Henle.
African American, Hispanic, and Asian are more susceptible to hypertension. African American are more likely to have bad reaction to other hypertension drugs, so diuretics are usually used for treatment with calcium blockers. Diuretics are the first line of treatment for hypertension. Some of the non-pharmacology interventions: slow sodium diet, exercising, and minimizing alcohol intake. Thiazide treat hypertension and peripheral edema. Thiazide causes more potassium, sodium, and water to stay in the urine and leave the body through urination. Some of the side effects and adverse reactions include dizziness, weakness, hypotension, GI distress, and electrolyte imbalance. Patients should notify the doctors if they experience any muscle weakness, cramp, sudden decrease in urination, and irregular heartbeats.
Okay, so I'll be speaking on the mechanism of actions and side effects of diuretics. So first, loop diuretics. Loop diuretics, it works on the ascending loop of the Henle as it is decreasing the reabsorption of sodium, as well as potassium, calcium, magnesium, and water. Side effects included with this drug are orthostatic hypotension, as well as muscle cramps, hyperglycemia, hyperuricemia, and hypokalemia. Next drug is potassium sparing. Potassium sparing, it blocks the action of aldosterone, and by doing this, it depresses the reabsorption of sodium, as well as increasing excretion of water and sodium. Side effects and adverse effects included this drug are kidney stones, ataxia, which is involuntary coordination or movement of the extremities or loss of voluntary control, and also, as well as causing breast enlargement in men. Next drug is osmotics, and osmotics works on the increasing osmolarity of the blood, which is also depressing the water reabsorption. And as it's doing this, it's also where the nephron is freely water permeable. And the side effects of this drug are chest pain, as well as phlebitis, hypotension, and heart failure. Last drug is CA inhibitors. And CA inhibitors, it works on blocking the formation of CO2, and the side effects are diarrhea, frequent urination, and as well as leaving a metallic taste in the mouth.
Okay, so now that we talked about the different classifications of diuretics, we're going to talk about some names you will see for the certain diuretics. So for potassium sparing, you're going to typically see the names amiloride and spirolactone. For your thiazide diuretics, you're going to see hydrochlorothiazide and metalazone. For loop diuretics, which are going to be your strongest diuretic, you're going to see furosemide, which are Lasix, and bumetanide. For your carbonic anhydrase inhibitors diuretics, you're going to have acetazolamide and methazolamide. And then lastly, for your osmotic diuretics, you're going to have the drugs mannitol and pamabrom. So what you want to teach your patient taking thiazide diuretics, that it can actually increase calcium. So you need to watch your calcium intake because it can cause hypercalcemia. It also can cause digitalis toxicity, which is signs and symptom of that is nausea, vomiting, so GI disturbances. It can cause you to have bradycardia, tachycardia, so just watch out for those signs and symptoms. It can cause hypotension when taking with ACE inhibitors and is contradicted in renal failure, gout, hypokalemia, and lithium treatment. With loop diuretics, you need to let your patient know to inform their physician if they are experiencing hearing loss or muscle cramps, especially since this is such a powerful diuretic. This can cause a lot of electrolyte imbalances. So they really need to monitor potassium levels, especially if they're taking another diuretic that makes you lose potassium. And then administer the IV furosemide slowly to prevent hearing loss as well.
We do have to do nursing interventions, watch out for their vitals, such as blood pressure and heart rate. We need to watch for their weight. And it is extremely important to teach the patient to limit their potassium intake as well. It is best to take with meals, and it is advised for patients to report any possible side effects such as rashes, dizziness, weakness, and GI upsets. The interventions that could be done is to monitor the weight and take an output. Can be life-threatening when taken alongside with ACE inhibitors. This drug can interact with NSAIDs, beta blockers, antifungals, lithium, metformin, clopidogrel gel, diuretics, and anti-epileptics. Some nursing interventions that could be done: monitor the blood count, platelets. It can cause metabolic acidosis, nausea, vomiting, anorexia, confusion, orthostatic hypertension. Could cause crystalline and hemolytic anemia can also occur. A patient who has schizophrenia led a lot of growth sat backtrack for them. So like they sat at 8 months, they walked at 14 months, their first word were said at 21 months, and first sentences were said at 27 months. The uncle of this child had schizophrenia. Clinicians noted that this patient, his language level was good. His teacher also noted, but this patient often had situation where he's lashing out on other children. He complains of ideas in his mind. He has monsters that are trying to hurt him despite any wounds visible on him. What they did, gave him risperidone and melatonin. It kind of helped, but not really. They decided to give him that medication. Had helped a lot. His internal world disappeared totally. He had imaginations and stuff. He was more relaxed. He was able to sleep better, and his schooling was easier. He was able to learn even better and concentrate even better. His teachers and relatives were saying that he was improving. But when he ended up stopping the medication, the hallucinations came back again. He stated that the symptoms were still present, but he can manage them and put them aside. We believe that diuretics does have a part on helping with schizophrenia patients.